Fleck, and I'll be organizing the webinar today on behalf of Global Bridges. Just a few housekeeping items before we begin. You are all muted for the duration of this webinar, but if you do have questions for Dr. Hawari, you can enter them into the questions pane on the right-hand side of your screen. During the webinar, I'll be sifting through the questions, and I will pose as many of them as possible at the end of the webinar. Also, this webinar will be recorded and archived on our website at www.globalbridges.org. So Dr. Feras Hawari is the Director of the Cancer Control Office and Chief of Pulmonary and Critical Care at King Hussein Cancer Center. He serves as a member of the KHCC Executive Council and is a full member at the Department of Medicine. He completed his residency in internal medicine and a fellowship in clinical pharmacology from the State University of New York at Buffalo, and also completed a fellowship in pulmonary and critical care medicine from the University of California, Irvine. Following his training, he worked at the USA National Institutes of Health. He is board certified in internal medicine, clinical pharmacology, pulmonary diseases, and critical care medicine. Dr. Hawari is a fellow of the American College of Chest Physicians and a consultant expert for the World Health Organization and the International Atomic Energy Agency in cancer control. So without further ado, I'm going to turn this over to Dr. Hawari.
Thank you, Jessica, for this kind introduction. I'd like to welcome you all for this webinar, and I'd like to thank Global Bridges for hosting this webinar. I hope that you can all hear me well. What I'm going to do today is to take you in a journey that discusses water pipe, basically, that is becoming really a hot topic, not just in the Eastern Mediterranean region, but also globally. Just a few disclosures that I would like to make. You can see them here on the screen, and in the interest of time, I'm just going to skip by them. And the outline of the talk is going to be the anatomy and epidemiology of water pipe. We're going to talk about toxicology, the evidence-based health effects, how do we manage water pipe dependence, and also is there any policy and what are the policies on water pipe in general. So moving into the anatomy of water pipes, there is a debate on how it all started, but we think that it started in India by an Indian physician who really started an idea that when smoke is passed through the water that is connected in the wall of the water pipe, it can be rendered harmless. And unfortunately, until today, this concept still stands and is very popular among people who smoke water pipe. And today, water pipe is becoming really popular everywhere, from the Middle East to Western countries. And as we can see that in these countries, they would have different names. So you will hear about shisha, you'll hear about nargila, you will hear about hookah. So these are different terms and different words used for water pipe depending on where you are. To talk briefly about the anatomy, we can see that the water pipe has a head and a bowl where you can put the tobacco and put the charcoal on top, as you can see here on the right-hand side diagram. Sometimes people would cover that with a wind guard so that the burning doesn't happen fast. And eventually, there is a pipe that goes down into the water, and eventually the smoke goes through that pipe when the person inhales, bubbles in the water, and then it is inhaled through a hose into the lungs of a person who smokes. And as you can see on the left side, there are now very innovative ways in terms of promoting these water pipes. You can see the melon on the left-hand side, and the hose going directly into that melon. The water is in the melon, and the head is also made of the melon, and all that to convey a healthy concept of the water pipe, and is part of the marketing tools of water pipes. And you can see also on the bottom that you can have water pipes that have more than one hose, and people can take turns in terms of smoking if they do not want to use and share the same hose. Innovative ways also, you have on the left lower quadrant of the screen, You can see the Porsche water pipe, and you can see on top, on the right-hand side, you can see one that is gold-plated, and the price of that can go up to $100,000. So really many innovative ways of promoting these water pipes. Now let's just go through this question now to try and emphasize certain points with regards to water pipe epidemiology. Some of these questions were particular to the epidemiology in the United States. So choose the single best answer. Of course, we're not going to choose, but we're going to go through them just to stimulate the thinking process and the discussion later on. The rate of water pipe tobacco smoke is highest among young people. The second is 30% of college students report ever using water pipe tobacco smoke. 10% of college students report using water pipe in the past 30 days. In the U.S., water pipe tobacco smoke is nearly as common as cigarette use. And the correct answer is number 5, which is all of the above. And just to give you an idea how water pipe is spreading across the world, if you look at British university students, a study showed that ever water pipe use in those students was about 38%. Same thing in French high school students, 40%. U.S. universities up to 20%. U.S. Colleges can go up to 29%, and the current users can go up to 7%. And if we even look at 12th graders in Arizona, for example, 7% of 12th graders and 11% of high school students ever use water pipe. 7% in 12th graders in Arizona are current users of water pipe. And how does that compare to what we have here in the Eastern Mediterranean region? If you look at regions just like Pakistan, for example, that number would go up to 33%. And in Jordan, if you look at university students, where I am right now, we find about 42% of them are current water pipe users. How about in healthcare professionals in the Eastern Mediterranean region? You can see that the numbers vary between Lebanon to Jordan, between 20 to 40%. So these are really high numbers, and it can tell you that the problem is still growing, and it will grow more across the globe. Again, looking at the prevalence of water pipe use among the youth globally, and if we look at the Global Youth Tobacco Survey between the years 1999 to 2008, that survey showed that while cigarette smoking is stable or declining, other forms of tobacco were showing a rising trend, and especially with water pipe. That report included more than 500,000 youth ages 13 to 15, involving 209 surveys in 95 countries and 5 areas. And if we look at the Global Youth Tobacco Survey result from 16 countries here in the Eastern Mediterranean region, and that included the Gaza Strip, the results suggest that the current water pipe smoking ranged between 6 to 34% among ages 13 to 15 years old. So these numbers, by all means, are alarming and indicate that water pipe is really spreading across the globe. A very particular study here that looked at water pipe and cigarette smoking among college athletes in the United States used an online survey of more than 8,000 college students at 8 institutions as part of the revised National College Health Assessment. They used a multivariable regression models to assess the associations between tobacco use, cigarette or water pipe, and organized sports participation. And this is what they found. They found that sports participants of any type in general had a lower odds of having smoked cigarettes. However, participants who played intramural sports or club sports had significantly higher odds of having smoked water pipe tobacco. The conclusion of the study that college athletes are susceptible to water pipe tobacco use, and compared with non-athletic counterparts, club sports participants and intramural sports participants generally had a higher odds of water pipe tobacco smoking. A lure for water pipe tobacco smoking may exist even for individuals who are traditionally considered at low risk for tobacco use. Now, all this is stemming from many myths and many misconceptions. So let's move to this next question. All statements are correct except water pipe smokers are as interested as cigarette smokers, including smoking. Number two, water pipe tobacco smokers can cause addiction. Number three, some of the nicotine is dissolved in the water, so smokers compensate by smoking for a longer duration and thus expose themselves to more toxins. Number four, water pipe tobacco smoking is affordable. So the answer is that water pipe smokers are as interested as cigarette smokers, including smoking. The fact that they are not, in fact, they are less interested. So this takes us into the question of why water pipe tobacco smoking is spreading across the globe. And there are many variables that people looked at, and that include accessibility and misperceptions. And we can find that water pipe is accessible, available, affordable, it is cheap, there are holes in the policies, and at the same time we have misperceptions, including that they are less addictive, that users can quit anytime they want, and that it is more socially acceptable than cigarettes, they can relieve stress and tension. So all these are fueling really the spread of the water pipe. And you can see here in the next slide that people end up gathering together to smoke water pipe. So it is really a social event. And you can see here people, you can see the cigarette packs on the table. So people are mixing smoking water pipe and cigarettes together. Now, we looked at the ethnicity and water pipe smoking among U.S. students to actually find out if that actually matters and would it help in spreading water pipe. This work was in collaboration with our colleagues in the U.S., Dr. Abu Ghosh and her colleagues. It was a cross-sectional study. It was an online survey for more than 2,000 people from March to April. The survey included questions on demographics and characteristics, tobacco use experience, risk perception, social acceptability, and popularity. And the study determined the predictors of water pipe use with three outcomes: ever use versus no use, past year use versus no use, past month use versus no use. And the results were the following. Half of the sample showed that they had previously smoked tobacco using water pipe, a third in the past year, and 12.5% in the past month. Significant predictors of water pipe use included Middle Eastern ethnicity, Middle Eastern friend, and past cigarette or cigar use. Perception of harm was associated with less use in the ever use model, and perceived addictiveness, social acceptability, popularity of water pipe were also predictors in all models. The conclusion of the study was that it is important to develop culturally appropriate interventions to control water pipe smoking among Middle Eastern Americans and those of Indian, Pakistani descent to curb further spread in U.S. society. It is also important to develop interventions that target the perceived addictiveness, social acceptability, and popularity of water pipe smoking. Now, let's move on to the toxins that are present in hookahs or water pipe. Before that, let's take this question. All of the following statements about toxins in water pipe are correct except mu'assal or flavored tobacco used when smoking water pipe contains a significant amount of nicotine. 2, the use of charcoal increases the health risks from smoking water pipe. 3, the water filters most of the toxins, rendering water pipe smoke harmless. 4, exposure to secondhand smoke from water pipe is harmful. And the answer is number 3, the water filters most of the toxins, rendering water pipe smoke harmless. So this is a wrong statement that we would like to convince people that it is really not true. Now let's move on to what type of tobacco is used in the water pipes. We have different types of tobacco. We have the flavored tobacco, and it's called masal. It can contain 30% tobacco and 70% molasses or honey with flavors, different flavors. We can also have the Jorat, Indian origin tobacco. It also contains fruits and oils, and also could be unflavored. And we also have the Ajami, tumbak, pure dark paste of tobacco. Tobacco used in one hookah session weighs about 10 to 20 grams depending on how big the head is. And this is a picture of the flavored tobacco, as you can see here. It's gooey, sticky, made from rotten fruits with different flavors, with honey, molasses, sugars, all sorts of chemicals added. And if we look at the additional health risk that is produced by the charcoal added, we can tell that there are really many chemicals and additional toxins that are present that are really not present in the tobacco itself or when smoking cigarettes, to the point that charcoal became a restricted product under the Hazardous Products Act according to the Canadian Department of Justice. And what if we compare cigarettes versus water pipe in terms of the pattern of smoking? When someone smokes cigarettes, they can inhale up to a liter maybe in 7 minutes, while when someone smokes water pipe, they can go up to 200 liters in 20 to 80 minutes, because nobody really smokes water pipe sessions less than that. Usually it's between 20 to 80 and sometimes even more in this part of the world. And it is equivalent, water pipe smoking is equivalent of up to 100 to 200 times the volume in one cigarette. And if we look at the toxins that are present, you can see that there are many hydrocarbons, many nitrosamines, and also heavy metals present, all kinds of heavy metals. So all these toxins, when you compare them to cigarettes, you can find that in a study done by Shhade et al. From Lebanon, that when you compare water pipe to cigarettes, you can find a lot more concentrations of toxins in water pipe compared to cigarettes. For example, arsenic, 165 versus 80, beryllium, you can find more in cigarettes, but again, look at chromium, it's a lot more, and so on and so forth. In addition, important things that we normally look at also, like tar and nicotine. In a session of water pipe of 10 grams of tobacco compared to one cigarette, you can find that you can get 72 times more tar that way. You can get 4 times more nicotine. The carbon monoxide can go up by more than 11 times. And of course, the other chemicals that we talked to. So now we are really piling the evidence, if you will, against water pipe use and safety. So we started by, talking about the epidemiology. We moved on into the anatomy, the toxicology that is now consistently showing that all the bad chemicals that are present in cigarettes are also, most of them are present in the water pipe, and in addition, you're getting extras by the fact that you are being exposed to longer periods of time and different forms of tobacco to higher concentrations. And if you look also at the puff topography, and our colleagues in Lebanon also worked a lot on that, you can find that there is a difference between the puff topography of water pipe versus cigarettes. So if we look at the number of puffs used or exercised when smoking cigarettes, that is between 8 to 12. When in water pipe, it is between 50 to 200. Of course, we talked about the duration of water pipe smoking. It's a lot longer than the duration of smoking cigarettes, with potentially inhaling a lot more liters of smoke than smoking cigarettes. and the level of carbon monoxide going higher, a lot higher, maybe 10 times more higher than smoking cigarettes. So moving on to a very important question, can water pipe cause dependence? We know that cigarette smoking can cause dependence, but what about water pipe? Well, let's talk about what we have with water pipe. One session of 10 grams of water pipe tobacco produces 4 times the nicotine in one cigarette. So if nicotine is the substance that causes dependence, we are getting a lot more nicotine with water pipe than what we get with cigarettes. In addition, studies showed that the daily use of water pipe produced a 24-hour urinary cotinine level of 0.785 micrograms per ml, and that is equivalent to smoking 10 cigarettes per day. In a study that looked at the subjective effects of water pipe and those who are smoking it, and it was a study of 61 people, and tested urges to smoke and many other variables that are related to smoking. But when we look at urges to smoke, restlessness, and craving of water pipe, they found that the pre and post smoking effects all showed a significant difference in favor of post-smoking water pipe, reducing urges to smoke, restlessness, and craving, again indicating the potential addictive nature of water pipe. In addition, other studies found a significant association between the number of sessions smoked per day and the time to the first smoke of the day, smoking even when ill, time to tobacco craving, and hating to give up the first smoke of the day. So all these, when we think about them, are very similar in those people who smoke water pipe and in comparison with people who smoke cigarettes. In addition, studies found that smoking and recovery phases after water pipe, tobacco smoking, and cigarettes showed similarity in the way they both suppressed withdrawal and suppressed craving. And the recovery of some of these symptoms can be faster, in fact, with cigarette users. A very important question and a very important study done by Eisenberg and colleagues actually looked at smoking water pipe versus a sham or a placebo, just to see if is it the act itself or does tobacco play a role. And they looked at water pipe tobacco smokers who completed 2 double-blind counterbalance sessions, tobacco and tobacco-free preparation. The tobacco-free preparation contained sugarcane, molasses, and flavors. And what they found is that independent of the condition, whether you smoke this or that, symptoms of urges to smoke were reduced and the direct effects such as dizziness, satisfaction increased, while the direct effects from nicotine actually increased. And if we look at the figure here, it shows clearly that those who smoked water pipe that contained real tobacco had higher plasma nicotine, as you can see in panel A, also correlated with a higher heart rate in B. The carboxyhemoglobin was similar in both of them, and the systolic blood pressure was higher in those who smoked real tobacco. As we had in, or we have in cigarette smoking, the dependence scale, the Fagerstrom scale, people try to actually come up with a scale similar to that. Again, our colleagues in Lebanon did the first, or developed the first Lebanon dependence scale. And it was the first scale to characterize the water pipe dependence. It had many items: psychological nicotine dependence, negative reinforcement, craving, positive reinforcement. And the scale was suggested and validated to be compatible with the Fagerstrom scale for cigarette smoking. However, it is a little bit more difficult to use than the Fagerstrom scoring. So now we've so far showed that there is ample evidence in the literature that water pipe can cause dependence. There are many harms and toxins. It is spreading and becoming very popular worldwide. What about the health effects of water pipe? The health effects of water pipe has been studied, and just to present a comprehensive review, this is a systemic review done by Atel et al. And what they did is actually they used the Cochrane collaboration methodology for conducting the systemic review, and they rated the quality of evidence for each outcome using the grading of recommendations. That is really a standard worldwide. They had an inclusion criteria and exclusion criteria. They included all observational studies, case control studies, and cross-sectional studies. They excluded case reports, case series, outbreak investigations, and abstract. And they excluded in this one the effect on pulmonary physiology. So they started with more than 1,600 citations based on their search, and it ended up with really 10 studies that met their inclusion criteria. And this is what they found based on the studies that they reviewed, that water pipe tobacco smoking was significantly associated with lung cancer, with respiratory illnesses, low birth weights, and periodontal disease. However, they did not really find significant association with bladder cancer, nasopharyngeal cancer, esophageal cancer, oral dysplasia, infertility, or hepatitis C. However, what they said that the overall quality of the evidence varied really between very low to low, indicating that we really need a lot more research to show the real harms and true harms of water pipe smoking. Moving on to what they excluded, somebody else looked at the water pipe effect and the lung physiology and exercise capacity. This study done by Rad et al. Looked at the effects of water pipe tobacco smoking on the lung function. They used a similar approach to what I've mentioned in the previous study, so I'm going to skip that approach now. Again, they started with more than 1,600 papers, ended up with 5 studies that made it into their inclusion criteria, and this is what they found. They found that water pipe smoking was significantly associated with reduction in FEV1, a trend towards lower forced vital capacity, and a lower FEV1-FVC ratio. And very importantly, they found that when they compared water pipe smoking with cigarette smoking, there was no statistically significant difference in FEV1, FVC, and FEV1-FVC ratio. And their conclusion was that water pipe smoking negatively affects lung function and may be as harmful as cigarette smoking and would likely be a cause for COPD. Now, when we started the talk, we mentioned about athletes and how they tend to smoke more water pipe than cigarettes. And we thought about studying the acute effect of a single session of water pipe smoking on lung function and exercise capacity in a pilot of healthy participants. So can really one session do this? This was actually done in collaboration with Tom Eisenberg from University of Virginia, Virginia Commonwealth University, I'm sorry about that, and through a grant supported by them. What we really did is we took 24 healthy water pipe male smokers. We asked them to have a baseline of lung function and exercise testing. We did the exercise testing on a bike. It is a cycloergometer using a standard protocol of 25 watts increases, and that happened every 2 minutes. We also asked them to abstain before the baseline. Again, we've rested them, and then we asked them to smoke a session of water pipe for about 45 minutes. And then after that, we've done immediately testing of lung volume and cardiopulmonary exercise test again after being exposed to 45 minutes. And this is what we found. The significant finding is that the oxygen consumption, which is an indicator of exercise capacity, fell significantly when compared before and after water pipe smoking, from 1.86 liters per minute to 1.7. Again, their FEF 25 to 75% went down. Their baseline respiratory rate before and after smoking at baseline was higher. The Borg scale, which is a measurement of exercise exhaustion, was higher at mid-exercise and at peak exercise when we did it before smoking and after smoking. In addition, their systolic blood pressure, their diastolic, their pulse pressure, and their pulse pressure product were higher when after they smoked a water pipe. Their oxygen pulse, which is an indication of an indirect indicator of stroke volume, but also can be reduced due to other causes such as muscle disease and cardiovascular disease, went down significantly before and after. And the slope of heart rate over the oxygen consumption, which basically in a very simple terms, the amount of heart rate that you need to perform that exercise went up, indicating that they needed more heart rate to perform the same amount of exercise. So all this really made us conclude that acute water pipe tobacco smoke appears to induce impairment in lung function and exercise capacity, which is something that has not been looked at before, and that we need to do larger studies to look at the extent of such impairment and such harm. Now, let's go to real life and get a talk to a patient or a subject who smokes water pipe. This is a real case scenario here. A 35-year-old healthy male smokes water pipe daily, just got married 2 years ago, and recently became a father of a 6-month-old baby. He has an 8 to 5 office job. His wife refuses to allow him to smoke at home. He leaves to a coffee shop directly from work daily. He self-referred himself after noticing that his marriage is in danger. This is a real case scenario coming out of our smoking cessation clinic. And it is a way to introduce the next topic, which is how do we deal with water pipe dependence and how do we treat that? So let's take this question. The pharmacological regimen that provides the best abstinence rates results for treating water pipe dependence is: number 1, nicotine replacement therapy; number 1, nicotine replacement therapy plus bupropion; number 3, nicotine replacement therapy, bupropion and varenicline; and number 4, none of the above. The correct answer is none of the above, because really there are no water pipe cessation intervention or randomized clinical trials that have been done and performed on water pipe. But what does that mean? Does that mean we should leave these people without treatment? And should we really wait for a randomized clinical trial in such scenarios? Well, let's answer first these questions. Are water pipe users interested in quitting? Well, studies have shown that they are less interested in quitting than in terms of cigarettes, so about 28% of them would be interested. The majority would report that the reason they want to quit is health reasons, and that about 60% of them, or 59%, made an unsuccessful quit attempt in the past year. More work that was done with our colleagues and the collaborative work with Dr. Abu Ghosh looked actually at beliefs in various smoking cessation interventions among the Jordanian adult smokers. And it was a cross-sectional survey-based study in a convenient sample. And it looked at the effectiveness and how people perceive the effectiveness of educational program, and also at cessation medications in terms of treating water pipe. And this is what we found. 63% of cigarette smokers and water pipe smokers believe that educational programs and counseling would work. However, there was a significant difference when it comes to medication. 53% of cigarette smokers believed that medication would work, while only 39% of water pipe smokers believed that medications would work. So far, the way we treat those who are dependent on water pipe has been based on anecdotes. There are really no randomized trials. And we need to carefully, when we determine how to treat these people, we need really to be very careful and get the details of their pattern of use. We need to do very good counseling and motivational interviewing. We should not compare cigarettes versus water pipe. And we do use in our clinic nicotine replacement therapy, varenicline, and bupropion for the treatment of water pipe. We have been trying to calculate the dose of nicotine replacement therapy. It is very difficult to do. So what we do is basically we start them on an approximate dose and then titrate that dose based on the symptoms of withdrawal or craving. And we have been combining in certain situations varenicline and bupropion in order to help maximize the results. Unfortunately, we do not have evidence. We have few people that came through the clinic and were able to quit, but we can't really say that we have a scientific evidence, but we are going to continue until we get a good randomized trial that looks at the effectiveness of such treatment. Now, moving on to the next topic, which is looking at policies, and let's start with this question. Most large U.S. cities ban water pipe smoking in bars. Number 1, true, number 2, false, and number 3, don't know. The answer is actually false. There is a study that looked at U.S. health policy related to hookah tobacco smoking. In this study, the objective was to assess how a representative sample of U.S. tobacco control policies may apply to water pipe tobacco smoking, and the method, it is municipal, county, and state legal texts applying to 100 largest U.S. cities were examined. I'm not going to go through this table. You have it, but just to summarize what is there, we can find that 3/4 of the largest U.S. cities disallow cigarette smoking in bars. However, nearly 90% of these cities may permit hookah tobacco smoke via exemptions. Closing these gaps in clean air regulation may significantly reduce exposure to hookah tobacco smoke. What about air quality? Another study looked at air quality and indoor air quality in Virginia water pipe cafes, and this was due to the revised indoor air quality law that has been implemented in Virginia to protect the public from harmful effects of secondhand smoke exposure. This legislation contains exemptions that include allowances for smoking in a room that is structurally separated and separately ventilated. The objective was to examine the impact of this law on air quality in water pipe cafes and compare the air quality in these cafes to restaurants that allow cigarette smoking and those where no smoking is permitted. The method of the study, indoor air quality was assessed in 28 venues, 17 water pipe cafes, 5 cigarette smoking permitted restaurants, and 6 smoke-free restaurants, 5 with valid data. Real-time measurements of PM 2.5 were obtained, and occupant behavior and venue characteristics were assessed. And these were the results. Water pipe cafe smoking rooms had the highest amount of PM 2.5, while smoke-free restaurants had the least. And smoking density positively correlated with PM 2.5 across smoking rooms, smoke-free restaurants, and PM 2.5 was positively correlated between smoking and non-smoking rooms of venues. The conclusion of the study was that air quality in the water pipe cafe smoking rooms was worse than restaurant rooms in which cigarette smoking was permitted. State-required non-smoking rooms in water pipe cafes may expose people and workers to concentrations above the national and international air quality standards. In addition, reducing the health risks of secondhand smoke may require smoke-free establishments in which tobacco smoking sources such as water pipe are prohibited. In the end, there are many things that we need to do and work on water pipe. We really need more research about trends, harms, and cessation. We need to have anti-tobacco regulations similar to cigarettes. We need to come up with warnings. This has been missing for water pipe. We need to fight the false advertisement about water pipe safety. Cessation interventions, really, at this point, we need them badly, especially in this part of the world where people, some people are interested in quitting, but unfortunately we've been so far working in the dark. And of course, we definitely need healthcare provider education about the risks to vulnerable groups. This was my last slide. I'd like to thank you very much for your attendance today, and I would be happy to take any questions.
Okay, thank you so much for us. For starters, we have a question from Gustavo Zabert. He's wondering about the health effects of secondhand smoke caused by water pipes. And you touched a little bit on it in your last few slides, but if you could elaborate, that would be great.
So the health effects so far, we have documented in the literature through extensive reviews that water pipe is definitely contributing to cancer. We have water pipe contributing to infertility, periodontal disease, and there is evidence that water pipe can contribute to COPD. So in general, we have the usual health effects that have been described for cigarettes and on both pulmonary physiology and non-communicable diseases.
Great, and sort of a follow-up on that, has the data on indoor air quality been used in the media yet?
The data of, yes, I can say we've been using it certainly here in Jordan, and especially now with the big hype about water pipe. In fact, this gives me the opportunity to mention that because of this big discussion now that is going on in water pipe in the region, the publisher for our study with regards to the acute exposure to water pipe decided to open this and make it an open access for a month. So in fact, if you are interested in that article, you can go ahead to the article and download it, and it's become open access now. I think we have we have about one more week left to access it freely. So yes, I know that we've been using these data here in Jordan to try and convince officials that we need to regulate this. And the past a couple of months now, there is a hot debate. The government decided to stop issuing new licenses and not to renew old licenses for water pipe cafe. That triggered really big demonstrations. So the short answer is yes. We don't know what would happen, but we're hoping for the best.
Great. We have one question, well, a couple actually, hoping that you can elaborate a little bit more on tobacco dependence treatment for water pipe users and the modified Fagstrom test for water pipe use.
Okay, so I'll take first the question with regards to the tobacco dependence treatment. So the way we've been using it, let's take the example that the subject that I mentioned in our slides. So this person would go to the cafe every evening after he leaves work. So what we decided in this person that they need, if we're going to use nicotine replacement therapy, and that's what we did, that they're going to start putting their patch on at least 2 to 3 hours before they leave work. So we don't start that in the morning in order to get it some time, to give it some time to work, and at the same time to get the higher concentration. We've also used varenicline, and we give them that on a regular basis, just like with cigarette smokes. And then we use PRN nicotine gum. What we do is, if we find that the subject is still feeling not satisfied, we would go ahead and upgrade their nicotine replacement therapy. Now, again, with nicotine replacement therapy, there's no way and there's no reason to stop at a certain level. Dose must be titrated to craving and withdrawal symptoms. Because, again, you will have variable concentrations of nicotine depending on how they smoke water pipe. As we said, puff topography gives you a wide window and a range of concentrations. So again, there is no rush. You don't have to make the right decision from the first time. It is a process that is long-term. It doesn't have to be right from the first time. You just start where you feel it is approximate and then titrate that up. Now, have we been successful with that? The answer, based on the few cases that we've treated, yes, we've been successful in few of them. We have very few cases. We have like 10 cases. We, in fact, thought about writing them up. Now, with regards to the dependence scale, unfortunately, I don't have the time to go through it, but you can actually access that online. It is a longer scale than the Fagerstone, and it has many variables that you need to look at and calculate. So if you are interested in that, we will make that available for you. Just send us your email, and we'll email you that, or we'll email you the link for that scale.
Great. We have a question from Deb Vizina. She's asking if we know how much of the harms are linked to the smoke rather than the tobacco, and what might the health effects be of the quote-unquote organic herbal mixes that supposedly have no tobacco, which are smoked in water pipes.
Yeah, that's an excellent question, and we get that all the time. You know, again, we need to think about the Combustion Act. Anytime you are burning something, you're going to get chemicals and extra chemicals. And of course, carbon monoxide will be the product of any combustion. Now, we are seeing these forms of electronic water pipe or water pipe that are using different forms of the regular tobacco, which is actually a nicotine-free substances. Do we really know what the harms are? Honestly, I don't, and I don't think it's been really well investigated. Again, I don't think it's healthy to burn something and inhale the smoke that is coming out of it, because we know that that smoke contains tar, contains carbon monoxide, and it will be harmful. So that's in a brief way of answering for your question.
Great. I'm actually wondering how we take into account the incredibly social nature of water pipe smoking. It seems like it's a more social activity than any other tobacco smoking. So how do we take that into account when treating dependence?
Yeah, that's an excellent question, and we definitely pay attention to that. And we do ask the subject that first they need to tell the people that they would like to quit, and then they need to stay away from these sessions if possible, not to go out with their friends in the first few weeks. Unfortunately, and again, this is very subjective, I think that the water pipe treatment is going to be very difficult because, you know, you could spend 6 months without smoking and then go out and then be tempted to smoke and have a session of water pipe thinking that, you know, it's not going to be that much harmful. So it is definitely a problem, and I think it is very challenging, but, you know, definitely it's something that we need to address.
Great. So along those lines, what do you think, I know there's a lot of different areas that we can focus efforts to control water pipe smoking, but what do you think the #1 area would be that would be most successful in reducing water pipe use? Would it be policy-wide or better treatment or education?
Well, I think since we don't have the evidence, I think we need to apply all, just like with cigarette smoking. I think education is extremely important. We have some hints from our study that people believe more that education can help. Definitely, I would encourage those countries that do not have water pipe yet a problem to start by banning the establishment of such cafes, because it is extremely seductive to have these cafes. It can really tempt people Even if they go in the beginning and they're not smokers, eventually they will try it. The smell of the tobacco is really nice. I would encourage people to try and push their governments to ban the establishment of these cafes. I think that's the only way that you can really stop this before it starts.
All right, well, it looks like we don't have any other questions. Oh, here we have one more. So water pipe smoking is very harmful, but many people are not aware. So how can we take that into a policy decision?
Yeah, I think what we've been doing with regards to that, we've been having extensive media campaigns, talking on TVs, radios, and newspapers, going to schools, just like with cigarette smoking. And that was actually part of the reason why eventually the government now in Jordan is trying to ban Waterpipe and stop licensing Waterpipe. And just to give people an idea, people come up with all these weird things. They mix alcohol with the water in the bowl so that they can get high with it. They mix all kinds of medications, just, even sometimes paracetamol or acetaminophen, ibuprofen. They grind it with the tobacco and they get high from it. So it is really, it's amazing how much how creative people can be with Waterpipe. And you really can't do that with cigarettes on the spot, but with Waterpipe, you can do it. Even at your home, you can do that. It's very easy to be done, and it is being done. So I think we really need to be very careful and fight this.
Sorry, I was talking on mute. Someone's asking if you can share some links to the resources that were used in this webinar, and I'm thinking that the best way to do that will be when we post this recording and the slides, that we can get some of the resources you've used.
We can certainly provide you with all the references that we have, definitely.
Great. So that will be available on the Global Bridges website, everyone, in the resources section later this week. I think that is all the questions we have, and we're right on time. So I'd like to thank everyone for attending. And if you have time, it'd be great if you could take the very short survey that will pop up once you leave this webinar so that we can get feedback and ideas for future webinars. Any last words, Dr. Hawari?
I would like to thank you all so much for being with us today, and thank Global Bridges for hosting this webinar.
All right, thanks everyone. Have a great day.
Thank you, Jessica.